we're just going to talk over the coming 10 minutes about where technology is taking us over the coming few years in spine surgery. So once again, those are my disclosures. I consult for a few companies. I sit in the advisory board of others. None of those are related to what I'm presenting today. Now, a couple of months ago, I was asked by the AO Spine Technical Commission to write an article about AI and machine learning and spine surgery. And I really do believe that it is a game changer, because AI has made the front page and the cover of every single major magazine that we know, to the point that Time magazine has called it the end of humanity. And I'm not sure that I fully agree with the Time magazine, but we actually look at the investment in AI over the past few years. We realized from this study from Stanford University that over the past few years, in 2021, we reached $250 billion in investment. And the healthcare industry is not different from any other industry out there. So if we take a look over here and we see the major 5 players, the major 5 investors in healthcare and in AI in healthcare nowadays, those are Google, Amazon, Microsoft, and Uber. And it kind of makes sense because all of those companies are coming from Silicon Valley. It makes a lot of sense that they're investing in technology. But if we actually take a look at the fifth company is actually Walmart. So if you see a company that's basically running on major supermarkets out there investing not just in AI in healthcare, so you know that we're about to see something very major coming over the coming few years. So it all started in healthcare with the introduction of AI in diagnosing chest x-rays, and now it has become, over the past couple of years, FDA approved, and the majority of the centers in the United States are actually having the algorithm, because it's much cheaper running the algorithm than just hiring radiologists to read chest x-rays in overtime and paying them a lot of money. We have seen AI being used in the diagnosis of neurodegenerative disorders, arrhythmias, and hematological diseases, to the point that this study was conducted in Columbia University in New York, comparing primary healthcare physicians versus machine in the diagnosis of major problems like hypertension and diabetes, with the machine outperforming the primary healthcare physicians in the majority of the times. This is the list of the companies that are now in AI that are FDA approved in the United States, and I can tell you that this list is getting bigger and bigger every single day. And I think we need to move away from the shallow thinking of this screw is better than that screw. I was earlier that day today standing out there with a company telling me how their threads are different from the threads of other screws, and the truth is, since the invention of the polyaxial screws, there haven't been that breakthrough in implants out there. Because at the end of the day, a screw is a screw and a cage is a cage. It doesn't matter what we really put in there. So we need to move away from that shallow thinking completely. So why adult spine deformity? Is because the population is aging, and it is anticipated that by the year 2025 that 1 in 4 patients that we're going to operate on is going to be older than the age of 65. And what we used to joke about before as the silver tsunami is now becoming a legit terminology that's actually being used in spine literature out there. But we know very well as well from the literature that from the ISSG studies that those surgeries are not complication free. So we know that adult spine deformity, in a study that involved almost 12,000 patients, there's a 55% complication rate. So 1 in 2 patients is going to end up with a complication. Now here's another study that was done by the same group that involved almost 300 patients, and you can see that the complication rate is 70% in 2 years. Those are crazy, crazy numbers. And try telling those numbers to your patients before you operate on them. I wonder if they're going to end up getting the surgery anyways. So the question is there anything that we can do about it to decrease that risk? So the whole thing started with the introduction of the frailty index. And the frailty index is something that we adopted from the Canadians. And what frailty means is that it's not anymore about knowing whether the patient has comorbidities or not. It's all about those small problems that those patients had. And those problems tend to come together and create a much bigger problem and put those patients at a higher risk of complications. We know very well from the literature nowadays that the more frail the patient is, the higher the risk of complications, including length of stay, PGK, pseudoarthrosis, you name it. So some of you might say, well, I'm not going to operate on those very frail patients. There is no point. They're going to end up with a lot of complications. So there is no point in operating on them anyways. But we also know from the literature that those patients who are very frail are the ones who did very well with surgeries. They are the ones who benefited the most when it comes to their functional outcome post-operatively. So I think AI can be helpful in this because it can predict your analytics and it can improve your outcome, and it can also help you with the surgical planning of your surgeries. And let me start here with the predictive analytics. So if you're a very good surgeon, like the majority of you sitting in the room today, when a patient walks into your clinic, you'll start getting into consideration his frailty index, his ODI, the BMI, the BMD, the narcotics. Is he a smoker, non-smoker? Is he a realistic patient? Is he a crazy patient? Would he understand complications? And the truth is, there is no single human being brain out there that can take all of this into consideration and come up with a number that tells you that this is the exact risk for this particular patient. But the machine can, because the machine can incorporate hundreds and hundreds of variables at the same time and come up with a number for this particular patient. So the ISSG, what they did a couple of years ago is that they said, well, let's put this to a trial. So they did run an algorithm, then they ran that by 1,600 patients that were operated already, and we know the outcome for those patients already. And then they asked the machine to predict the outcome, and believe it or not, the machine was accurate actually 90% of the time. Now I can see some of you sitting out there saying, well, I'm expert enough, I have been doing this long enough, I don't need a machine to tell me the outcome of my patients, I know who to operate on and who not to operate on. Well, that's why the ISSG and the European study group decided to conduct this study. So they included 9 operated ASD patients, again, that we know the outcome for already. And then they asked 39 of the expert deformity surgeons around the world. Those are the best deformity surgeons out there, or at least the busiest. So they asked them to predict the outcome of those patients, and it was funny because it was all over the place. So for one single complication, as you can see over here, one surgeon predicted 0%, and for the same complication, the exact same complication, another surgeon predicted 100%. So we're not very good in predicting the outcome of our patients. But let's take a look at the machine. The machine was actually much better again in predicting the outcome of those patients that were operated already. And the reason for that is that we take a lot of decisions every single day in our clinics based on emotions. So if you see a patient earlier today for a follow-up that you operated 6 weeks ago and he's developing PGK, it's highly likely that if you see another patient later this day who needs a deformity surgery, that you'll be under the impression that he's going to end up with the same complication. And that's, unfortunately, that's the nature of us as human beings. So let's see what the machine does. The machine actually does plot you on a curve over there, and it basically compares you to thousands and thousands of patients that were operated around the world. And based on that, it tells you the exact risk for this particular patient. Now, a couple of months ago, when we published our data about the risk of complications in spine surgery and wound infection in the MENA region, I was very excited because for the first time, we could tell the exact risk and the factors contributing to wound infection in this particular part of the world. But as I grow older as a spine surgeon, I tend to realize that this is not enough. Because it doesn't make any sense when a patient walks into my clinic today for another spine deformity surgery and tell him, listen, your risk for complication is somewhere between 0 to 70%. Is it 20? Is it 40? Is it 60? We need to be able to plot him in a curve and tell him exactly what his risk of complications is. And let me switch gears here and talk about surgical planning and AI in surgical planning. And here I want to introduce you to a company called Medicrea. And I know that the majority of you haven't heard about this because this company has been obviously bought by the blue tycoon Medtronic a couple of years ago. So now what you can do is actually you can take screenshots of the spine x-rays of the patient. You can upload them on the system, and it can help you with planning your osteotomy sites, your cage placement, and your rod planning as well. And let me leave you with this case over here. So this is a 54-year-old female patient that had ankylosing spondylitis, chin and chest deformity, severe back pain, unable to look forward. And on top of that, she had a history of falling a couple of years before presenting to us. So that was her x-rays, and as you can see, she has an SVA of 23. Her mismatch is somewhere around the 27 degrees, and she's one of those nasty classic ankylosing spondylitis patients. This is her CT scan, and you can see that all the levels are fused, and you can see that there are a couple of fractures that are happening from the previous fall that she had 4 years ago. On top of that, she has some element of cervical myelopathy with the MRI that we did, because we did see that she did walk somehow funny as well. So what we did, we decided to stage it, to do traction for her. Stage 1, do C2 to ilium instrumentation and decompress that cervical spine for the element of myelopathy, and then take her on another day, do the PSO and do the deformity correction. And the idea here is not to say, oh, we should have gone a level below or a level above. That's not the idea. The idea is to show you how AI can be helpful over here. So this is her after traction, and you can see that she corrected a little bit after a couple of weeks of traction. And this is her after the first stage of surgery, and you can see that the SVA is now down from 27 down to 13, and her mismatch is somewhere at the 19. At this point, we took those images and we uploaded them on the system, and you can see that it gave us two options. The first option is to do a PSO at L3, and the second option is to do a PSO at T12. So we elected to go with the TL3 PSO, and then we uploaded the images to the system, and we got the custom-made rod, and you can see here that the rod is bent to 90 degrees. Now you guys tell me the number of times you ended up bending that rod to 90 degrees. So this is our surgery over here, and you can see that the rod did sit beautifully over there, and you can see that the post-operative picture is exactly similar to what the machine predicted pre-operatively. And now our parameters are basically back to normal with her mismatching around 8 degrees. This is her pre-op, before the second surgery and after the second surgery, and this is before, after stage 1 and after stage 1. Why is this important? Because one of the number one reasons...
summarize? Time is running short. Yeah.
One of the reasons is basically taking back those patients back to the OR is breakage of the rods. And AI can decrease that from 22% down to 5%. So, in my opinion, AI can be very helpful in your practice nowadays because it can help you with surgical planning. It can predict the outcome of those patients, and it can also help you with predicting and getting better outcomes for those patients as well. And then the machine, the data that comes out of the machine is only as good as the data you put in. So make sure that you upload very accurate data because that's going to help us down the road. Thank you very much.